Hello and welcome to another episode of Outpatient Clinic. Please do not forget to smash the like button and hit subscription or subscribe button so that these videos can go everywhere. Today we're going to talk about osteoporosis or fragility of the bones. So what is osteoporosis? Osteoporosis is a systemic skeletal disease characterized by low bone density or bone mass and deterioration and consequent increase in bone fragility and susceptibility to fractures. It affects 1/3 approximately of postmenopausal women. How do you diagnose it? You take a good history from the patient, you examine the patient. I always tell people or medical students that I teach, examine from head to toe. Talk to the patient thoroughly because the patient knows what's wrong with them in a lot of cases. We measure the height, we measure the weight, we check the body mass index, we also check the arm span. We check for any spinal or bony abnormalities. We a lot of times order x-rays or a test called bone density. This is a very good test that tells us if your bone is healthy, or osteopenic means slight weakness in the bones, or osteoporosis, a lot of weakness and fragility. Osteoporosis can be secondary or can be primary. Osteoporosis can come due to a lot of endocrine disorders, such as Cushing syndrome, where the suprarenal gland, the gland above the kidney, secrete a lot of cortisol, or hyperparathyroidism, the gland above the thyroid glands do a lot of hormone called parathormone, increase calcium in the blood but decrease calcium in the bone and cause fragility. Hyperthyroidism is a lot of thyroxine by the thyroid gland. Or on the contrary, Addison disease, where you have low cortisol, and Addison disease is characterized by low blood pressure, low sodium, high potassium. They may have tongue brownish discoloration. All of this, your doctor can easily pick up with some labs and exam. But there's also neoplastic disease, such as cancers, different type of cancers, such as multiple myeloma. A disease or a type of tumor affect the bones and affect the blood, and some chemotherapeutic agency can cause osteoporosis, and some radiation therapy can help in the fractures from cancer or mets to some bones, particularly in the back. Osteoporosis can occur with patients on dialysis or chronic kidney disease, and people will have intestinal malabsorption. They cannot absorb the calcium or vitamin D for whatever reason. How you treat osteoporosis? First, try to prevent osteoporosis. Stop smoking, stop alcohol, stop a lot of addiction to caffeine, exercise, very healthy lifestyle, eating healthy, and prevent falls. And a lot of women and men, elderly, we tell them take vitamin D and calcium supplement. Sometimes your physician, if you are a postmenopausal woman, would give you hormone replacement therapy as to balance estrogen and progesterone together. We don't like to give a lot of estrogen alone, postmenopausal women, because estrogen alone can induce cancer of the breast or cancer of the cervix or uterus. Bisphosphonate, a group of family of medication called bisphosphonate, such as Fosamax or Actonel. Fosamax is taken once a day, 10 milligram a day, or 70 milligram a week. You have to take a big glass of water and standing position because it irritates your esophagus. You can take calcitonin, it's inhaler or subcutaneous injection, can bring the calcium from the blood to the bones, or fluoride or raloxifene. Some risk factors such as white men especially and white women especially, or white elderly men, and Asian race more susceptible. Thin people, especially thin women, petite women, can have more prone to osteoporosis. family history of osteoporosis, sedentary lifestyle, early menopause, women that get menopause very early at age 40 or so, cigarette smoking, excessive caffeine, and low calcium in the diet. All of these are risk factors. How to prevent osteoporosis? Do some exercises, jogging. I tell people if you can't go to the gym, at least walk around your block. Half an hour every day is very healthy. Adequate intake of calcium. Young adults, we like 800 milligram per day. Pregnant lactating women, we increase that to 1200 approximately milligram per day. Postmenopausal, 1000 to 1500 milligram a day. There's a lot of calcium over the counter, and talk to your doctor. There's a lot of vitamin D over the counter too. Vitamin D, adults 400 international units, seniors 800 or more. Vitamin D3 comes in 2,000 international units a day. Sometimes 1,000 is enough. Sometimes in severe case of vitamin D deficiency, we prescribe 50,000 international units vitamin D every week. We do check vitamin D2 level in the blood. Modify factors that can increase risk of osteoporosis, such as alcohol, caffeine, smoking, hormone replacement therapy for postmenopausal women. This is the healthy bone. You can see the vertebrae, very healthy. Here is not healthy. Here, a fracture in the hip joint, as you can see. The neck of the femur got broken from a very slight fall. The reason is this bone is very fragile and osteoporotic. Here, another view of the healthy bones in the vertebrae and the spinal cord, around the spinal cord. This became kyphotic, kyphosis, and he became bent. He lost height. Some of these bones, like this one, you can see if I pointed, we use the pointer here. You can see this bone is fractured and kind of narrowed and weakened. On the slide on the bottom, it shows the fracture. It shows a man or woman with loss of height. It shows chronic neck pain or joint pain. It shows the posture itself became bent and the bone became very thin. All of these are symptoms of osteoporosis. This is slide of a healthy bone right here on the left side. On the right side, you see this is very fragile. You don't see much white density of the bone. You see a lot of grayish, and here a line fracture. This is the fracture. This bone got fracture of the neck of the femur. This is MRI of the spinal cord. You can see here start of a fracture is not healthy. Here, dense fracture. You see this vertebrae. Compare this one with the top one. This is the healthy. This is broken. This one again is very broken, and this one, all of this broken with a loss of height and fracture. We call it compression fracture. Some men and women can get compression fracture just from slight bend of their spinal cord, or they bow down to get something, or they fall out, or they fell down. They get compression fracture, L1, L2, L3, whatever. The treatment depends on the case. If there is 20% height loss, severe pain, unbearable pain, sometimes we admit them through the emergency room, give them intravenous pain medication. We talk to the interventional radiologist about vertebroplasty or kyphoplasty. We go with the needle in interventional radiology in the operating theater downstairs, and they put a needle with a material to build up the bone, something kind of like a glue. I'm just making it simple for you to understand. And build up this bony structure, bony vertebra, and the pain goes away the next day, some physical therapy, and you go home. But we don't tend to do this procedure for every single person. It has criteria. A lot of times we order TLSO or a brace around the back, around the area where the vertebral fracture. We give them calcium, vitamin D, pain medication. We do physical therapy. We send them to a nursing home if they need it. And with that, you get better, and the bone itself will heal, but it will take several months, up to 3 months. With that, I hope I summarized the osteoporosis. Be very careful about your dietary intake of vitamin D, of calcium. Live healthy, eat healthy, do some walking, and talk to your doctor about osteoporosis and the treatment modality that fits you. Thank you very much for your time. I appreciate your time and kindness. I hope to see you soon in another episode, Outpatient Clinic. Thank you.